Warm welcome, Jeff.
Thank you, John. Appreciate it, sir. Good morning. I know a lot of you guys traveled far to get here. Came from Detroit. It's not that much warmer here than back home, and I'm still trying to figure that one out. But anyhow, it's great to meet everybody. Longtime veteran, been in the space now for 26 years. Actually started off my career in the pharma space, working for the CMO of Pharmacy and Upjohn when I was paying my way through college and trying to study abroad in Spain, creating crazy decks for many wonderful brands, Propecia, but I don't know if I actually bought that one. But yeah, it's great to meet everybody. Wanted to really start off too and just share a little bit about kind of what's top of mind. We're speaking and sponsoring at 94 events in person this year. We did 84 last year. And so busy times ahead. But obviously a hot topic across the industry has been what happens, right, when third-party data goes away? First party, right? So, you know, a lot of people are trying to figure out solutions. Some people have solutions in place. I like to tell people if you only have one in place, that's actually not a solution, because we're all in the R&D space, especially in the health and pharma marketing world, right? So you can just read again some of this high-level strategies kind of happening. You know, 22% have a strategy in place. How many people in the room are executing a cookie-less strategy or first-party strategy today? 4, 5. So again, everyone's claiming to have one, 49% by the end of this year, right? But again, it's got to be more than one. That's the challenge, right, for a lot of people. Right, it's always about what's the unique identifier. A cookie is simply one identifier invented around really kind of digital display assets, right? That's how it was originally created. It was never designed to carry the weight that it's carrying today. A lot of challenges, with that. Happy to talk with everybody later about that. But AdMedia, again, we'll spend some time with you guys. We have some folks here from the team. Danny BB here, our CEO, founder, been in the space, behind the scenes, the most humble CEO you'll meet in the industry. Get time with Danny at some point over the next few days, and Noreen and Andy as well. But here's just a quick overview, 1 minute of what we do and how we could really help you guys, if it works, and it didn't work. So we'll share the video afterwards. It'll be on the MediaPost website as well. But bottom line is, over the last 2 decades, we've built our own tech stack. So think of us as our own DMP, DSP, SSP, video player, mobile, et cetera. But really, our secret sauce is our first-party data on about 230 million people across North America. So very robust profiles. We actually own and operate 1 million domains. Started off in the domain acquisition space. And so some of those like cured.com, are very obviously high quality towards the health space as well. Again, from a reach perspective, it's substantial. Again, happy to find time with everybody specifically to unpack deeper here. But again, reach for us is really big, but at the end of the day, it's about performance. If it's kind of high value actions or cost per or lifetime value or new patients, doctors, caregivers, et cetera. When we're benchmarked or baselined against like a Google, non-brand, conquesting, et cetera, we usually win 90% of the time, and this stat says 34 to 75% improvements. So the numbers speak for themselves. We definitely welcome, again, trials and moving forward as well. But again, think of us as kind of full funnel reach across the spectrum, but really performance-based is the heart of what we do. Regarding conditions, this is just, again, a couple samples of what we do, looking at intent throughout the last 30 days of throughout the DMP. So a lot of reach, right? Many other categories, right, are represented here in the room, right? So not just pain and skincare and diabetes and different types of cancers and many different things. So again, happy to kind of go through separately. I know we're meeting one-on-ones with a lot of people in the room, but just to give you a sample. From a reach perspective too, we're excited to announce one of our new strategic partners, exclusive to us, which we just rolled out, and there's many down the pipeline coming this year over the next 2 months. New York Post is one of them. So we're powering search on that site and a number of ad implementation types. But again, from an integration perspective, from a QVIA to Crossix to Google, Adobe, and everything in between, again, from a tech perspective, we're pretty well integrated across the ecosystem as well. But if it's a back-end API feed and custom as well, we can certainly handle that. So really quickly, one of our other patents that we'll talk about and share with the team here is our two-click search widget model. People ask us all the time, how is search evolving, right? How do I really kind of diversify away from one or two partners so I'm not having all my risk in one basket or two baskets like a Google or a Meta or other folks in the industry for that matter. So we built a two-click search widget model where we really kind of display at the personal level dynamic keyword clouds and then have that be available. So if somebody's on a cured site looking for a solution, we can capture them. The person here is qualifying themselves further or pre-qualifying themselves further, and then they would land on the advertiser's landing page. So it's a very seamless solution for patients, right? Our caregivers looking for solutions as well. And then dynamically as well, we do power search implementations on a lot of different sites as well. So a lot of stuff that we have in the hopper from an R&D perspective. One of the other hot topics in the industry is contextual, right? So contextual means a lot of things to different people, right? So there's a lot of frustration or saturation and confusion in the marketplace with contextual, right? So we have the patents on contextual. So it's our own crawler technology. We were in R&D for 5 years building the solution. As well, we index and crawl 1.4 to 1.9 trillion data calls a day as well, and we use that data to refresh our audience segments in real time, so it's not dependent on a third-party or sub-syndicated source as well. So a lot of different data points, over 30 we capture on every crawl that happens as well. So again, that's definitely something that we can talk about to help capture customer intent throughout the CDJ as well. And then some case studies. I'm not going to get into specifics here on these, but this is an at-home testing solution that we put into place. Brand was really kind of looking to kind of reach people beyond traditional engines when CPCs in pharma can be pretty high, right? Arguably the highest in any other industry other than maybe things like auto insurance, right? So we don't have the saturation as the major engines, so that's why we are able to typically outperform everyone in that space. But again, an at-home testing provider. This is a top 5 pharma company that we worked with as well. So this was a matter of how do I reach more people looking for their products. And again, from a conquest perspective, competitor conquest perspective, we do really, really well. So outperformed by over 56% compared to what they were seeing with, again, major folks in the space. And then segment. So that's kind of like a non-brand reach as well. So definitely looking forward to spending time with everybody. Wanted to kind of just give you guys a quick overview. We've been to many Media Post events, as John was mentioning. We actually started sponsoring all of their events, really from COVID shutdown through virtual to back in person. And then we're proud to be the inaugural premier sponsor of the first ever Media Post Pharma Summit that was in Deer Valley, this one, and then coming up. So again, thank you to Seth and John, all the Media Post team for orchestrating everybody in this room as well, getting everyone together. So looking forward to seeing you guys. Let's grab a drink together. Danny, you want to raise your hand, just so you guys know? Danny, Noreen, Andy, come grab us. Fun group. I recommend kayaking if you guys haven't done it through the caves, by the way. It's a pretty cool event to do. Just don't touch the sea lions and you'll be in good shape. So.
All right.
Thanks, guys.
Thank you, Jeff.